This video will discuss low-carb diets. They're common today, and can they be followed safely and wisely? Absolutely. But first, what is considered a low-carb diet? Diets that are low in carbohydrates, about 40 to 60 grams per day, is considered to be low. But for context, the recommended macronutrient distribution of a typical 2,000 calorie diet is about 45 to 60% of calories from carbohydrates. That's about 200 to 300 grams a day. And then 10 to 35% from protein and 20 to 35% from fat. Following the recommended macronutrient distribution, utilizing nutrient-dense choices, provides carbohydrate to break down into glucose and absorb through the small intestine, where then they travel to the liver and are stored as glycogen for the body to use for blood glucose, energy stores, and a variety of metabolic needs. But with any diet, the type and portion size matters. Low-carb diets can be healthy if made up of nutrient-dense choices, lean meats, fish, eggs, and healthy fats for the protein and fat needs. And the high-quality carbs that are consumed to meet those nutrient needs will help manage hunger. Unfortunately, many people do consume simple and refined carbohydrate sources. They're low in nutrient quality, which can increase hunger. Processed grains such as white bread and white rice have a low nutrient profile and are metabolized and utilized by our body similar to candy and soda. Definitely not something that's going to help benefit our health as well as weight management. A low-carb diet that results in less simple carbohydrate consumption is instrumental to weight loss, and commonly where part of the weight loss comes in people that change from a high-carb diet to a diet that is lower in carbohydrates. Again, it's the complexity of the carbohydrate, the fruits, the vegetables, the whole grains, the wise choices. Some findings related to the role of carbohydrate distribution on weight loss include a reduced appetite with the low-carb diets. That's because it takes longer to break down and metabolize protein. And low-carb diets may also affect the appetite control hormones ghrelin and leptin. There's also a slight increase in metabolic rate due to the creation of glucose in the body from non-carbohydrate sources. But what is healthy? There are many studies that have tried to look at the role of low-carb diets. One, the optimal macronutrient intake trial for heart health, found that a healthy diet replaced some carbohydrate with protein or fat and did a great job of lowering blood pressure and bad LDL cholesterol. Even better job than a healthy higher carbohydrate diet, but the focus was on nutrient-dense choices throughout those diets. A 20-year prospective study of 80,000 women looked at the relationship between lower carbohydrate diets and heart disease. A subsequent study looked at lower carbohydrate diets and risk of diabetes. Women who ate low carbohydrate diets that were high in vegetable sources of fat or protein had a 30% lower risk of heart disease, and about a 20% lower risk of type 2 diabetes compared to women who ate a high carbohydrate but low fat diet. But women who ate low carbohydrate diets that were high in animal fats or proteins did not see any such benefits. Again, it's the types of foods that you choose to eat, and look at the amount of foods you have been eating. If your diet is very high in those simple carbohydrates or refined grains, by taking them out of your diet, it can definitely improve your health and probably lead to some weight loss. The highest risk of low-carb diets is the transition to increased carbohydrate consumption. Attention to fat and protein intake, while carbohydrates are gradually added back into the diet, is key to prevent weight regain. The bottom line, the highest success rates with weight loss, weight maintenance, and health focuses on nutrient quality and consumption of a variety of foods in moderation.